today's COVID-19 office hours. We are so happy to have you all here today, and we'll spend just a couple of moments going over some logistics and technical notes before we turn things over to HUD and our fantastic team of presenters today. So first and foremost, a reminder that we are recording today's office hours as we do each time we meet. We will post a copy of the recording along with the slide deck and the content from the chat to the HUD Exchange at the link that's up there on the screen right now. Just please give the team a couple of business days to get them posted, and we promise they will be there. If you have any audio issues during the webinar, you can go ahead and switch over from the computer audio to the phone. That is in the chat box right now, that dial-in up information, and that was on the prior screen. And if you want to engage with us throughout the office hours today, which we hope that you do, please do so by sending in messages through the chat functionality. So you want to be sure to send all questions, thoughts, feedback in through the chat feature. And to do so, just look at the bottom right-hand side of your screen. You'll see the chat bubble. If you open that up, it should default to everyone. If it does not, just take a moment to make sure that everyone is selected, because we want to make sure that those messages go to all participants as well as the team of panelists and presenters. And with that, I'm going to turn things over to Karen de Blasio from HUD's Office of Special Needs Assistance Programs. Karen?
Everyone, thank you, Natalie. As Natalie said, I'm Karen de Blasio. I'm a Division Director in the Office of Special Needs Assistance Programs, or the SNAPS office. Norm is out today. He normally facilitates, but I'm taking his place for this afternoon, so I'm happy to be here with you all. We have a really full agenda, lots of really good topics that we're discussing today, so I want to get into it as quickly as possible. Just want to highlight a key thing, a couple of things here. You see there's a list of SNAP staff that are typically on the call. Some of them you'll hear from, some of them will be answering questions in the chat, as Natalie explained. We're very excited today to have our Deputy Assistant Secretary of the Office of Special Needs, Ms. Jameen Bryan. You'll be hearing from her in just a minute as she kicks off our first set of speakers. We're also very happy to have Mr. Donald Whitehead, who's the Executive Director of the National Coalition for the Homeless, speaking to you today as well, and you'll hear from him in a few minutes. Next slide. We have, as usual, Ashley Meehan from the Centers for Disease Control and Prevention. You'll be hearing from her for the CDC update, Barbara DePietro from the National Healthcare for the Homeless Council, and our partners from the Department of Veterans Affairs, Dina Hoosier and Jillian Weber are on as well. So we thank everybody that's joining us. Thank you all out there that are joining us on this beautiful Friday, and I want to hand it over to Jameen. Jameen?
Thank you so much, Karen. Good afternoon, everyone. It's my pleasure to be here with you today. One, to primarily sort of thank the incredible team who has continued to put on these office hours throughout the pandemic and has been doing just such a wonderful work, getting all partners engaged and all in an effort to really ensure that people experiencing homelessness or at risk of homelessness are kept safe and are addressed. But today, in particular, I had to really join the office hours to address the atrocities that have been committed against people experiencing homelessness recently in New York City and the District of Columbia. Like you, we at HUD have been closely following reports on a string of shootings across these two cities. My heart goes out to the victims and their family and friends who were affected by this senseless violence. I'm very, very grateful to the police departments in DC and New York City who were able to make an arrest and continue to work hard on this ongoing case. And while an arrest may bring some level of relief to this specific threat, that cannot lull us into a false sense of security. Violence against people experiencing homelessness is not an isolated incident. People experiencing homelessness, especially those experiencing unsheltered homelessness, are at an elevated risk for being victims of violent crime. The horrific shootings that occurred recently brings the violence against people experiencing homelessness into the national spotlight. It is our continuing duty to ensure that the work to mitigate this risk of violence does not end when the news coverage ends. The violence against our fellow community members is, again, unconscionable. And while there is more that HUD can and will do, please know that there is already TA and other resources available to help. Bottom line, the most effective way to keep people experiencing homelessness safe is to house them. We must continue our work to bring an end to homelessness in the United States of America. On HUD Exchange, you can find information on rehousing people experiencing unsheltered homelessness, serving people with high acuity needs, and information on working in partnership with other stakeholders to address the homelessness response system. You guys have all been doing amazing, amazing work in this area, especially driven to an all-time high level because of the pandemic. I want to express my gratitude to you for all of that hard work. I also want to express my gratitude to two community partners who will present today on this issue of violence against people experiencing homelessness. Mr. Donald Whitehead, who is the director of the National Coalition for the Homeless, and Ms. Barbara Depicia, who is the senior director of policy for the National Healthcare of the Homeless Council. Both of these organizations have conducted research on violence against people experiencing homelessness. I asked Donald and Barbara to join us today to talk about their reports and to provide recommendations and strategies for what homeless service providers, advocates, and the greater community can do to help prevent violence against people experiencing homelessness. Again, thank you for being here today, and overall, thank you for the work that you do every day. Donald, I turn it to you. Thank you.
Thank you, Deputy Assistant Secretary Brian. Really appreciate your thoughtful words on this issue. And I will echo what you said in the very beginning of your remarks, that the incidents, as horrific as they were this week, they're not isolated by any stretch of the imagination. Living on the streets of America is a very dangerous place for all of the people that are living in this country without housing. We have actually been working on the civil rights and protection of people experiencing homelessness since our beginnings in the late 70s and early 80s. We were founded on the principle of civil rights for people experiencing homelessness. For the last 20 years, we've actually been documenting as best we can violence against people on the streets of this country. And we have actually documented what are considered hate crimes against people experiencing homelessness. And these are considered hate crimes because the perpetrators of the crimes have said that they committed these crimes simply because the people who they inflicted the violence on were homeless. And the range of crimes is as heinous as you can possibly get. While we shudder at this event over the last couple of months, there have been crimes committed against the homeless in the last 20 years that would make you shudder even more. In 1999, in the Colorado area, there was a person who was beheading people that were homeless. There was another event out west where people were being drowned intentionally. And one of perhaps the worst was a 9-month-old child who died as a result of her housing unit being firebombed because the community didn't like the fact that there was a housing unit for homelessness, for people experiencing homelessness in her community. So if we go to the next slide, we, over the past 20 years, we've documented 1,852 reported acts of violence that have been committed against homeless individuals. Reported violence has occurred in 48 states, Puerto Rico, and Washington, D.C. And most of the perpetrators of these acts were generally males under the age of 40. Sometimes it was a crime of convenience. They did it just because the homeless person was there. But just as in this recent case, it was an event where the person actually sought out and targeted people that were homeless. And to the next slide, please. So to really give you a scope of how incredibly common this is, so the FBI does document hate crimes against all its protected classes, and that's people's racial and ethnic background, people with disabilities, religious, um, uh, people's religious backgrounds as well. But most communities do not document the deaths of people based on their housing status. What we've been able to do over the last 20 years, we've gotten more and more sophisticated as we look at these issues. We have to rely on reports in the media and reports from service providers. But we actually double, triple, quadruple check these reports. So it isn't just anecdotal. It's actually some really intensive research after we find the reports through a search through the country. And what we've documented is since 1999, 515 people experiencing homelessness have violently lost their lives simply because they did not have a home. And if you look at the same period and you look at all the other hate crimes combined, the FBI reported 258 deaths. So take a second to think about that. Almost double the number of deaths among every other protected class has occurred in the homeless population in this country. So I'll go to the next slide. So just the most recent study we did from 2018 to 2019, there were 83 incidents of anti-homeless violence. 39 victims experiencing homelessness lost their lives. 97% of the lethal attacks were perpetrated by men. 77% of the perpetrators, as I said, were 40 years or younger. 85% of the victims who lost their lives were men, and 65% of the victims who lost their lives were older than 40. Next slide, please. There's been there was a significant decline in 2020, but the number began to creep back up in 2021 and returned to pre-pandemic levels beginning in August of 2021. We have seen many more confrontations beginning in December of 2021 until now. We've seen violence, we've seen destroying campsites and private unsanctioned groups who have taken it upon themselves to force the relocation of those without housing. These private vigilante groups are making things more and more difficult for those without housing to be safe. And I just want to touch on that point for just a second. What happens when people are removed from safe spaces or spaces that they're in community with other people is they become dispersed and they're isolated in places where there is less protection, and it offers the perpetrators of these crimes a lot more opportunity to be able to inflict violence among homeless people. So we encourage you in your community to really speak out, especially the vigilante groups, but also elected officials in both Washington, D.C. and New York City. We had elected officials who had just started to do um, what I call raids. I won't call them sweeps because language is so important. And when we talk about raiding encampments as sweeps, we are devaluing the people in those camps, because what you usually sweep is trash and you sweep leaves. You don't sweep human beings. So what those are raids, and people lose their ID and they lose all of their belongings. And again, they're put in places where they're a lot less safe. We'll go to the next slide. Um, and the challenge for being able to advocate on behalf of people experiencing homelessness when it comes to violence is, I should state that that number that we gave you is absolutely an undercount of the violence. One, we don't include homeless on homeless violence. until now. We're gonna do that as well. But the other big barrier to being able to get completely accurate numbers is most jurisdictions do not report on crimes against people without housing. They actually don't track housing status. There are a few communities that are starting to do it after relentless pressure by the National Coalition and other groups. The LA, for instance, is one community that does track it, and they found that in their recent study, and you can go to our website to get the study. It's on the mortality of people experiencing homelessness in the United States. And in that study, what they found is that people experiencing homelessness in LA are 14.3 times more likely to die of homicide. Again, 14.3 times more likely to die of homicide. And actually, they're far more likely to die in general. Most of the other reasons for death are preventable as well, but 14.3 times more likely to die of homicide. And so there are some things that can be done. We have been meeting regularly with the Department of Justice. We met with the Deputy Assistant Director of the Civil Rights Division of the Department of Justice recently, and we've also met with the groups that are looking into these crimes and what they're asking us to do. And you certainly can help us by sending information to the National Coalition. What they want to do now is really look at people's rights being violated who have other disabilities. So if a camp is raided, if a person who is in another protected class is injured, they want that information. Right now, they're looking at 3 cities because there's been multiple reports of this kind of activity, and that those cities are Minneapolis, Phoenix, and Louisville. So if anybody is out there listening from any one of those communities, you have some information about any violations of people's rights in an encampment situation or violence against them, we would love to have that information. The other thing that is happening, and we're hoping that people will get involved in, is pushing your community not to move people. The CDC, who will be on next, will also tell you that from a disease perspective, moving people in encampments is the wrong thing to do. So we are hoping ultimately to get people experiencing homelessness as another protected class. And we're working with other civil rights groups to move to have that designation made for people who have the experience of being homeless. So I'll go to the next slide, which will give you information on how to reach the National Coalition. Please, if you can, I'll put my personal email in the chat, and I would love if people have any information about people being targeted, people being injured during any kind of violent confrontation or an encampment raid. I would love to get that. So I appreciate the opportunity to be with you. If you go to our website, 20 Years of Hate is on our website. All of that information is there. A lot of really sad information. A lot of really troubling events have happened across this country. We hope you'll take the opportunity to take a look at it. And we also want to make sure that you know that our next speaker has been our partner in most of that. And I'll say one last thing. We actually, instead of doing a hate crimes report this year, we're going to expand the breadth of our report to include all kinds of violence. So not just those that were considered hate crimes, but violence in general. I think it's so important that we really take the opportunity to help people understand the realities of homelessness in this country. I feel like right now we're losing the battle of public opinion. People are sort of satisfied with the conditions and not as supportive as they have been in previous times. So hoping that people will join us in helping us to reclaim that territory where there's compassion around the issue of homelessness. So I will stop there and pass it on to Barbara Depicia.
Thank you so much, Donald. Really appreciate it and appreciate your partnership in this and your leadership on the research that you've been doing and on violence against people experiencing homelessness. You've been at the forefront of this for years. I also want to thank HUD for spending time today to talk about this. The murders that have happened just in this last week have been very upsetting. I work here at the Baltimore City Healthcare for the Homeless program, and this is something that clients are talking about. And this is something that really makes an impact on people's, just their worry about their own personal safety. So I'm glad just to share just a little bit about the work we've done with our National Consumer Advisory Board and our consumer-led research on the issues of violence and how this impacts people experiencing homelessness from their perspective. And so we'll just plunge right in by going to the next slide. So a number of years ago, this is actually in 2014, we did a consumer-directed research study involving consumer leaders in 5 cities, asking about consumer experiences with violence. And all told, we had about a little over 500 people participating in this study. And what we found was that violence is really endemic among the people that we serve. And from their own reporting, a third of those in the survey had been attacked just in the last month, with almost 3/4 within the last year. And nearly everyone at some point in their experience of homelessness had a violent attack against them. I think it's notable too that 20% of those had been attacked 4 times or more. And then additional information at this study, 62% of those surveyed had witnessed a violent attack. And again, even witnessing attacks on others is extremely upsetting. And the mental distress and the worry that comes with that can have really debilitating effects. So this was something that we had published in Violence and Victims as a peer-reviewed journal. And I circled the names of most of the authors of this study were people with the lived experience of homelessness. Next slide, please. In this same study, we wanted to find out, where were you attacked? What was your relationship with the attackers? What were the injuries that you sustained? And this is really troubling. Again, almost 60% of those who had a violent attack said that it happened on the street or the alley, similar to the murders from DC and New York. 16% happened in a public park. But notably, for our discussion here today, 13% said that a violent attack had happened to them in a shelter. You can see the wide range of injuries here. And as healthcare providers and the healthcare for the homeless community, we are always having to treat the injuries that our clients are sustaining. And this is dental, this is physical, this is mental health, this is substance use. Everything that happens in violent attacks can trigger people's recovery and trigger relapse. It can have lifelong implications for your mental health and for your physical well-being. You might notice that most people knew their attacker in some way, but almost a third did not. Again, similar to the attacks that led to today's discussion. If we can go to the next slide. So based on that study, 2 years later, and this was in 2016, we wanted to know more about what makes our clients feel safe, particularly in service settings. And we wanted to ask the clients that we serve, how safe do you feel at healthcare for the homeless clinics? A number of our clinics are based in shelters. How safe do you feel getting services at the locations where we're offering our care? And what we found here is the respect and the tone of the program really makes a difference. And so you'll see here, what are the most important factors in feeling safe at healthcare for the homeless site? And I would extrapolate this to be other places where people are served. Being treated with respect, the presence of security, knowing and trusting the people that I am working with. All of these were really common responses in our survey. And if we go to the next slide, some of our further findings. You can see here again, coming back to respect and tone. What makes you feel safe? Staff at the site treat me with respect. Security staff make me feel safe. The staff are capable of calming down a tense situation. Really coming back to staff skills, staff training. And so one of the things that we were particularly concerned about is that when people don't feel safe, and that might be either in our facility or in the area immediately surrounding our facility. So sometimes our programs are located in places, in neighborhoods where people don't feel safe walking the sidewalk, even to come into our front doors. And so how often have people perhaps avoided service, not gotten care, or left because they didn't feel safe? And these are the things that we really wanted to learn more about and have an honest conversation. And when you had said that we would be talking about violence today, I was thinking about a focus group that I had conducted in Yakima, Washington, just even 2 months ago about our medical respite program there. But what I was thinking about was a man who was talking about while he was in respite, he was talking about how the reason that he was in respite is because someone assaulted him with a 2x4 while he was asleep on the street. And now he's so scared. And one of the things he said was that, you know, I'm 65 and it angers me now that I'm afraid. And he says, once you are weak, they'll come for you on the streets. And this is something that I just feel is so viscerally tangible in the worry that people have about their well-being, that they can't sleep at night. And so a few things that I just wanted to mention too is, I know a lot of us are screening for, or we wand for weapons coming into our programs. And I think one thing that we should think about too is that weapons sometimes are often for people's self-protection. And so and it's very hard for us as service providers to discern whether something is being used for protection or might be a weapon that's used in violence. And so that's very hard for us to tease through. And it's also true that many of our clients are working in industries where they have to carry their tools with them that also could be used as weapons. So thinking about our clients that work in kitchens where they might have knives, or constructions where they have hammers or screwdrivers or other tools. Again, these are things that we really have to tease through. Someone's employment, is this something that's a safety issue? Is this something that's a protective issue? Again, very hard, but I think for us as service providers to have those honest conversations. And then finally, I just wanted to say that here at the Baltimore HCH, again, just one more consumer perspective that I've had in just my conversations with clients. There's a number of people who sleep on our front porch at night. And so we wanted to try to know more about why people were sleeping on the front porch of healthcare for the homeless when truly there is a shelter 2 blocks away. And one of the things that one of the gentlemen said to me was, you have a camera that is on the front porch. And I know that if someone kills me in my sleep, maybe you'll have video of that and they'll be caught. And that was probably 8 years ago that he said that. And that still breaks my heart when I think about, because these are the kinds of decisions that our clients are making when they lay down their role at night. What kind of things are they looking for so that they can feel safer at night? So if we can just go to my final slide. One of the things I wanted to talk about today was, so what are the actions we can take as service providers? And so when we asked our clients, you know, who would you prefer to respond to a conflict or incident? Many people pointed to security staff. They wanted security staff to be a presence for them that could help maintain a safe environment. They wanted to see either trained peers, clinical staff, or any of the above be able to de-escalate situations. And so I just have 4 things that we might think about. One is, do a survey of your clients and your staff about how safe they feel and get their suggestions for program improvements that you might make, and maximize your consumer leadership to do this. Think about how you can increase your security presence in and around your program, how you can add lights and camera, not only to add actual safety, but also a feeling of sense of safety and security because people know that you care. Third, again, coming back to the training and making sure that our staff, especially our security staff, not only just de-escalation training, but cultural humility, trauma-informed approaches, and really putting a focus on respect for clients. And then finally, I think this is really hard, but really important for us to do, is have honest conversations with the current conditions at our programs and really talk about the presence of weapons that are worn by security personnel. For some clients, having weapons on security makes them feel safer. And for others, it absolutely does not. In fact, it further traumatizes them. Depending where you are in the country, again, our culture of guns may be different in different places. But again, I think this is something that really needs to be teased through. And I think as service providers, all of us have an opportunity here to really step up the safety that we're offering the clients that we serve, because they are so at risk of the violence that we're all talking about here. And finally, I just want to say, I want to come back to the comments that Deputy Assistant Secretary Bryan made earlier in her comments. The best way to prevent violence against people experiencing homelessness is to house them. And so I want to come back to that full circle. Thank you again for having me to talk about this today. Really appreciate this conversation. And I will turn it back over to you, Karen. Thank you so much.
Thank you, Barbara. Thank you, Janine, Barbara, and Donald. I quite frankly hate that we had to hear from you guys about this topic today, but we really appreciate the work that you all are doing. I'm sitting here with the chills, like hearing some of your stories, thinking about the guy on the porch saying, "Well, there's a camera here." I mean, that literally just. So thank you, Donald. Thank you, Barbara. Thank you for. I didn't see any targeted questions directly for you all in the chat. I'll keep my eye out, but again, just thank you for this presentation, for the work that you guys are doing. It's very important, and you know, hopefully we can see a better day for our clients very soon. So what I'd like to do now is hand it over to our partners at the CDC, Ashley Meehan, sorry. She's going to give us a COVID-19 update.
Thanks, Karen. And I just want to echo a thanks to the previous presenters talking about this topic. I think it highlights the fact that COVID is not a lot of people's priority when they're having to think through how they'll stay safe through the night. So I just want to acknowledge that that's the case, and we understand that, and we see that, and we feel that. But hopefully this update will give you what you need to know to keep moving forward. And sorry, it's a clunky transition from the violence topic to this topic. So thanks in advance for your grace on that. But for those of you who don't know, my name is Ashley Meehan. I am a health scientist at the CDC working on our homelessness unit. So just a quick overview of where we're at with COVID-19 cases over time. You can see all the way on the right side there, we are in a pretty low level nationally with where cases are at. We're not at zero, but we are still on the decline from our Omicron surge, which is good news as we hopefully are heading into some warmer weather. Next slide, please. At the last office hours, my colleague Emily Masitis reviewed some changes to CDC's guidance on some new metrics that the agency is using to assess COVID-19 community levels. So previously, the COVID-19 community transmission only looked at transmission, but now we're moving towards a space of how do we account for hospital capacity and hospital burden as well when we think about what level communities should be in. So if you haven't already, go ahead and take a look at this website. It is hyperlinked in the slides, and we can put the link in the chat as well. But we are still using similar terminology of low, medium, and high categories. I do want to mention that this category classified as low, it can include communities that have absolutely zero transmission. However, if your community is in the low category, that does not necessarily mean that your community has no transmission. So even if your community is still in this low category, there are still some prevention measures that should be in place. And so we're happy to talk through what those are if your community needs some help thinking through them. Also on the community levels website, there's some information on some core prevention strategies, and we will be updating our guidance to reflect that as well in the coming weeks. So stay tuned on that. If we can go to the next slide, please. So this is what the new community levels map looks like with those new indicators. So rather than just highlighting as blue is good and red is bad, there is a little bit more nuance to understand transmission in combination with hospital capacity as well. So this is what our map is looking like. There are still some areas that are having, either high rate of transmission and or decreased hospital capacity. So you just want to flag that. But again, even if your county is highlighted as green, that doesn't mean we should throw all prevention measures to the wind. We do still need to take caution because it does not mean there is absolutely no transmission. So just wanted to be clear about that. I know there's been some confusion about that lately. Next slide, please. All right, some of you may have seen some headlines recently about the BA2 lineage of the Omicron variant. That is highlighted in kind of a light pink color here. So CDC does do genomic surveillance, and sequencing. So this is what we're looking at in terms of percentage of COVID-19 cases that are affiliated with each lineage. We are seeing an increase in that BA2 variant. For now, continue, taking those preventive measures. Stay up to date on your vaccinations, wash your hands frequently, get tested when you can. Of course, if you have symptoms or have symptoms similar with COVID, stay home and stay away from others when you can. So just wanted to flag that has been in the media. That doesn't change much for now yet. Stay tuned. CDC is keeping an eye on that, and we are tracking that in the US. Next slide, please. And that's all from me. I'm happy to answer any questions here or in the chat. Back to you, Karen.
Thanks so much, Ashley. It looked like there's one question. I think the person was asking what precautions should they continue in green communities?
That's a great question. Thanks for that. So ideally, that would be in discussion with your local public health department. You'll want to consider, what the characteristics of your facility are like. Do you have clients that are mostly over the age of 65 or who are older? Do you have a lot of clients who are at higher risk of severe disease for COVID-19? What does the facility layout look like? What is the facility's ventilation like? So you'll want to talk through those things with your local public health department to see what makes sense for your community and for the facilities that you're working in. So it's hard to say like one blanket prevention measure or set of prevention measures that shelters should be implementing, because each shelter is different and the clients in each shelter are different. So sorry, that's not a more prescriptive answer, but that's our recommendation, to work with your local public health department.
Thanks, Ashley. That's helpful. I don't see any other questions. You might want to just keep your eye on the chat, but I think we're okay to go to our next slide and our next presenter. Our TA spotlight today is, the topic is program transfer considerations for households in ESG CVRRH programs. And I'd like to hand it over to Megan Takashima to talk a little bit more about that. Megan?
Thank you, Karen, and thanks everyone for the opportunity to join the office hours today. Wanted to talk to you about a document that was published about 2 weeks ago, and I went ahead and put that in the chat. As Karen said, I'm Megan Takashima. I worked with Apt Associates and was part of the team kind of working to develop this document. So if we could go to the next slide, please, that would be great. And I think just to sort of reflect on what we heard today in the earlier presentations, it's really clear the importance of moving people to permanent housing and how that increases their safety. And so at the same time that we're aware that ESGCV is to a certain extent winding down, I think the hope is that communities are still working to get people into permanent housing through the rapid rehousing program, and to think about, as they're moving forward with housing placements, how they'll manage that over the course of time when ESGCV winds down and there are other programs that folks may need to transfer to. And so as ESG recipients, it is really important to work with COC partners, to work with your local coordinated entry system and with your subrecipients to be sure that you're on the right track for transition and that process is going to be seamless, particularly for the individuals and households who are being served in the program. And so a couple of thoughts about how to address that. One thing is really to know that if your community does not have an established policy and procedure for rapid rehousing transfers, they really should establish one, and ideally doing that in partnership with people who have lived experience of homelessness. I think for those of us who are on sort of the service or administration side, we understand the importance of keeping people in housing, but there may be some considerations that we just won't have top of mind. And so being able to have that partnership to think through sort of all of the aspects of a transfer is really important. And then if you do have those transfer policies within the communities that you're working in, it's probably important to pull those out, dust them off, and re-review them just to make sure that the process is clear, that it's person-centered, and that it reflects the specific requirements of ESG and ESGCV and the current funding landscape. So all of that is really essential as you start to move forward. Next slide, please. And then I think one thing to just really emphasize is that as you think about transfers that would need to happen, those really must emphasize client's choice. And one of the reasons that we're emphasizing or encouraging you to start thinking about this right now is just because without some advanced planning, it really is hard to sort of navigate client choice and make sure that this process runs smoothly and that it gives some care and consideration to any potential harm that could result from the transfer. And so one thing I think is that we know that individuals and families who are in the programs that are being served in ESGCV, they're aware of things like expenditure deadlines. They talk amongst themselves. And so it's probably important to be transparent about that deadline and that a plan will be worked out to transfer that household to another form of assistance if they need it. I think just sort of addressing that up front can really help with some of the stress and uncertainty. In many cases, the transfer may require a household to be assigned to a new program or case manager, and it's really important to ensure that the household feels comfortable with the program or organization that's proposed for that transfer, and that is largely driven by client choice. One other thing to note is that even with a well-coordinated transfer, it could potentially be traumatic for households who have to establish a new case management relationship. And so making sure that there's a trauma-informed process in place can really help during an uncertain time. Next slide, please. So one thing I think that's important to emphasize, and I think this is something that can occasionally be confusing or misunderstood, is that households who are receiving rapid rehousing assistance maintain their homelessness status. This is true for the purpose of eligibility to other programs that require a household to be literally homeless. So there is a FAQ that's published. I put a link here, but there's also a link to it on the last slide that sort of breaks this down. So just important to remember that you do have the flexibility to move a household to another program that may require them to be homeless. And so, we strongly encourage you to take advantage of that flexibility because it's going to help people sort of obtain and maintain housing over the course of time. I think the one thing to note is that additional eligibility criteria may apply, and that's going to depend on where the household is transferring to. The next slide, please. And so I'm just going to talk through a list of potential transfer options. I think, even knowing that ESGCV won't be around in the way it has been, the funding landscape is sort of different than it was years ago. And so it's probably important to think through strategies that kind of address the specific needs and wants of the household that you're serving, but also reflect sort of some of the newer programs. One program for a potential transfer is annual ESG, just to emphasize that transferring a participant from ESG to CV to ESG would not require a new intake or eligibility assessment, and the transfer itself would not trigger a reevaluation requirement. If the participant has not yet received the maximum amount of rental assistance allowed, they would continue to be eligible for ESG rapid rehousing. Obviously, the requirements of the program still exist, but that transfer itself does not trigger sort of an additional eligibility assessment. I think the one thing to note, obviously, is that as we move back to sort of the regular allocations for ESG, it may be challenging to move everyone to annual ESG, so it's probably going to be necessary to think about some of the other programs. One of those programs, obviously, particularly for people who maybe need a more intensive level of care, is the Permanent Supportive Housing Program through the COC program. Eligible ESGCV rapid rehousing households would need to have a documented disability to qualify for PSH. And it's also important to keep in mind that if the project is dedicated to households experiencing chronic homelessness, the participant must meet that chronic eligibility as well. So that may be a logical option if it becomes clear through the course of the participation in the rapid rehousing program for that client that they're going to need some additional assistance. There's also the opportunity to use emergency housing vouchers or other housing choice vouchers that may be available in your community. You know, EHD, many of the AHP units may be leased up, but units that become available or vouchers that become available through turnover could be leased up through September 30th, 2023. So it's probably a good idea to think through how you might navigate this for households that are currently in rapid rehousing through your coordinated entry system. So definitely something to think about. Another option would be home or home ARP. And I think specifically thinking about the tenant-based rental assistance program or TBRA would be a logical option, and those programs will potentially be up and running at the time that you would need to. Home TBRA can provide security deposit assistance or monthly rental assistance payments for up to 24 months with the potential for contracts to be renewed beyond that 24 months if needed. Next slide, please. A few other options just to consider. We recognize that you know, communities have sort of different collaborations and different pieces in place, but CDBG or CDBG-CV could allow for some additional rental assistance, potentially up to another 6 months of rental assistance. And this is often referred to as emergency grant payments or subsistence payments. CDBG-CV funds are available for 6 years after the signing of the grant agreement. So there is sort of a longer runway to expend those funds. And so that might be an option in your community. There, of course, is also the Emergency Rental Assistance Program, which could provide additional assistance. And, you know, that's going to depend kind of on what's happening in your community. In some places, I know the ERA funds may be expended, and others, they may still be available. But the ERA2 funds expire on September 30th, 2025. So there still is several years that those funds could be spent. And then a last consideration could be the Department of Treasury American Rescue Plan Act or ARPA funds or local fiscal recovery funds. And this is a pot of money that could provide rental assistance and housing stability assistance as well. These also have a longer runway. There were allocations given to states, territories, counties, and metropolitan cities, and there are links to all of those now. If you need that additional information, that will be in the slide deck when we send it out. Next slide, please. I think one other thing that's really important to note, and this probably isn't enough information if you have some specific questions, but it's also important to think about how you're documenting your program transfers in HMIS. There are different methods for transferring participants from projects to projects, and these are identified in a document called the Grant Consolidation and Closing Projects, How to Handle Client Data in HMIS document. There's a link to that as well. And then also thinking that and being aware that data entry in HMIS must comport with the instructions provided in the HMIS Data Standards Manual. So just want to emphasize that if you do have questions about this documentation piece, or if you're struggling with anything there, you know, strongly encourage you to submit a request, a AAQ request. I think the same is true if you have questions about specifically navigating some of these transfers and making sure that you fully understand the eligibility requirements and how you would move forward with that. So I think we can go to the next slide. And this is just a list of some of the resources that I referenced or others that I thought would be helpful. And so hopefully these are things that if you have additional questions, you can ask about. One document I would point out that I think was published just yesterday is this fourth document down, using CDBG emergency payments for rental assistance and coronavirus responses. So that may be something, if you weren't aware it was published, might be something helpful to take a look at. And I think that is the end of this slide deck. So I don't know if there's any questions, but I can turn it back to Karen.
Thanks very much, Megan. There were a couple of nuanced questions that I want to give us a chance to try to answer in the chat maybe, or have you take a look at. So I won't wing them at you right now, but there was one, somebody was asking if you knew of any transfer plan templates that were available, or if any communities already have transfer policies in place that they've maybe shared, or so I'm not sure if on the TA side, if you're aware of anything.
That is a great question, and nothing specifically comes to mind, but I imagine there are some out there. So that might be something that we should, do some digging on to try and lift up some examples that could be a helpful sort of first draft or start for communities who are thinking through this. I appreciate that.
Great, thanks very much. Our final section for today, you can go to the next slide. I'm going to hand it over to Marlisa Grogan, who you all know well. She's going to give us a little bit of an ESG CV grant status report and talk about the specifically the Q6 quarterly reporting that deadline that's coming up soon. Marlisa?
Hi, everyone. It's good to be with you today. I wanted to first start with an update that's going to be taking place in stage associated with a deployment that's about to take place. And so the intent of this update is to relieve some of the reporting burden for those associated with those projects that have closed or where the financial assistance has ended. So when you are expending funds during a particular quarterly reporting period, you're required to report on the expenditures associated with that project as a recipient, as well as the data collection requirements. When there's no longer any expenditures associated with a particular project, you are required, or the expenditure reporting ends, and the project is essentially closed out. However, for cumulative reporting, up to this point, that project had the bundle has to be continually brought forward. And with this update, the bundle is actually pulled forward by the system so that recipients don't have to go in and manually do that. So you're going to see this change in the screenshot right here showing step 3 where you're identifying ESG CV funded projects. You can see under subrecipient 1 that the project is closed at the end of Q3, and the uploaded cumulative bundle for that period is 10/1/2020 through 6/30/2021. And then in step 4, when you click Create Bundles, the bundle with the closed project is now on the list as already submitted, so you don't need to manually submit that project. So you will see these changes in Sage, and not only that, we do have a supplemental reporting instruction that's going to be available to you on the HUD Exchange. So that it's a 2-pager that takes you through more detail about what the actual steps in the system were prior to this update, and now just explaining so that there are no surprises when you actually look into the system. It'll take you through the process of what you should see for those closed projects that the bundles are pulled forward. We don't have a slide associated with this, but I did want to just draw everyone's attention to the current status of ESG CV draws. Nationally, we're at about almost 37% drawn. So, so we're at 36.7%. And we just encourage everyone to continue spending and making sure that you get your QPRs in if you haven't already, if you're behind on any. So we're trying to anticipate the next upcoming quarterly report that's due, and we just want to try to get rid of any backlog so that everyone can get up to date on reporting as of the next QPR. As always, if you have any problems, please contact your CARES Act desk officer. You could also submit a question through the AAQ. And with that, I'm going to turn it back to you, Karen. Thank you.
Thanks, Marlisa. I'm going to take a quick look and see. I did not see any specific stage or QPR questions. So that concludes all of our presentations for today. I'm just doing a quick scan in the chat. I think most chat questions have been answered. Just to cover a couple of bigger topics. Somebody asked very early on in the chat about whether or not HUD would be providing extensions for waivers that are expiring at the end of the month. And that is for COC, HOPWA, and annual ESG. So that is not our plan. They will expire on March 31st. I think the person that asked was mostly concerned about the 24-month cap on rental assistance, as that does expire at the end of the month. We will not be extending those. Brett did provide some pretty detailed instructions in the chat, though, that if you do continue to need regulatory flexibility, you should submit a waiver request. And that would be following what we'll say is, quote, the normal process. And really, the recipient needs to start by reaching out to the field office. They'll be able to instruct them. But I think a lot of people were concerned about the waivers. I'm looking to see, somebody provided the link for office hours, so you guys can see the slides whenever they're, and you can watch the office hours again if you'd like. Usually it takes us about 3 to 5 days to get that up. Couple of questions about ESG and FMR. If a household transfers to annual ESG and their unit is over FMR, does the FMR waiver stay with them through the duration of their lease? And I believe Marlisa answered that, and the question was yes, it does. The waiver is in effect for the duration of their period of assistance. I don't know, there might be 1 or 2 more that were specific to this transfer. And if we haven't been able to answer in chat, I would, I would ask you guys just to submit, as Megan said, some of these are really nuanced and we might need to have some conversations with you. So go ahead and submit a question on the AAQ and we can definitely get you an answer that way. And with that, I'm just going to double check one more time. I don't see any other questions. So I think I want to thank everybody out there today who tuned in to listen to us. I want to thank all of our presenters, all of our resource advisors on the back end who've been answering questions. And I hope that today was helpful for you all. And I hope that you guys have a really great weekend. So thank you, everybody, and we will talk to you in 2 weeks.